Today here, we're going to be doing a workshop purely informational, just an educational overview for folks on the phone or on Medicare. We're not going to get into specific carriers or pricing that's out there for specific carriers. And we just want to help educate and inform folks on the system, how it works. And, the audience is across the board. We've got some agents on the phone that are going to learn some more about Medicare. And there's just some folks that want to learn more about it for their own selves, or for a loved one that is close to them that they want to learn some more about Medicare. So we're going to get started. So there's three sections to the presentation. The first section is an overview on Medicare and how do Medicare Supplements work with Medicare. And we'll also talk a little bit about Medicare Advantage Plans and some rules for when you should be enrolling for Medicare, and for folks that are working past the age of 65, also get into some of the rules around those situations. The second section that we go through is Part D of Medicare. How does that Part D of Medicare work? What is the coverage gap or donut hole? How does that all work together with the prescriptions that individuals are taking? And the third section, which really isn't a section, but throughout the presentation, we're going to highlight the top 5 mistakes that people make while on Medicare. And this is, again, from years of experience, from all the examples we've seen. We've got about 20,000 clients on Medicare, and from a volume perspective, what are those top 5 mistakes we see, and also an impact perspective? What's the impact it has on individuals if you make these top 5 mistakes? So we'll recap those at the end, but you'll hear those throughout the presentation as well. So first off, with the 4 parts of Medicare. So Part A of Medicare is hospital insurance. So this essentially is your benefit that covers if you get hospitalized. It also covers if you get transferred to a skilled nursing facility care as part of that hospitalization. So that's all covered under Part A of Medicare. For Part B of Medicare, that's your outpatient, your medical insurance, your doctor's visits, your x-rays, your testing, chemotherapy, kidney dialysis. All of that would fall under Part B of Medicare. It also covers preventative services as well. Part C of Medicare, and this I believe is actually a misnomer. It's not really a part of Medicare. It's another way for you to take your Medicare benefits. It's called a Medicare Advantage Plan, and essentially it's a fully privatized plan that's handled by an insurance company that's basically taken over your Part A and B benefits for hospitalization and doctor's visits, and as well as in most cases a prescription plan as well, and bundled it all together into a Medicare Advantage Plan, or like an HMO type plan. Part D of Medicare is your prescription drug coverage. So we're going to get into this a lot towards the back half of the presentation and how this Part D of Medicare works. But essentially it's to cover your prescription costs. Each one of these is a row at the bottom of this table, and it has a premium associated with each one of these parts. For Part A of Medicare, the majority of people don't pay anything for Part A of Medicare. As long as you've worked 40 quarters, or your spouse has worked 40 quarters in your lifetime, which is essentially 10 years, doesn't have to be consecutive, and during those quarters contributed to Medicare and Social Security tax, then the Part A premium is free. There's no cost for that. If you do have to pay for Part A, it's actually quite expensive. It's about $420 per month for the Part A premium. If you do have to pay for that, again, that's the exception. For Part B of Medicare, for the majority of people, they're paying the $104.90 per month or $121.80 per month for the Part B premium. On the next slide, we're going to get into, there's actually 5 different income adjustment tiers, depending upon how much modified adjusted gross income you have. That's going to determine what you pay for your Part B premium. For Part C, these are Medicare Advantage plans. The pricing is going to vary depending upon the carrier and the coverage. We're not going to get into specifics today on all the different options that are out there. Just know that they do vary depending upon the plan that you accept. For Part D, the plan premiums will vary based upon the different prescription card that you go with, but there's also an income adjustment if you're above a certain income threshold, similar to the Part B income adjustment. So we're going to walk through those as well on the next slide. So what are those tiers of income for the Part B monthly premiums? For a majority of people, they're in this first tier, which is if you're filing a joint tax return under 170,000 modified adjusted gross income, or if you're single under 85,000 modified adjusted gross. And if you're in this first tier, you're going to be paying for your Part B premium in 2016. It's either 104.90 or 121.80. And I'll get into the difference in a minute. But if you're in a higher income tier, you're going to be paying an income adjustment on your premium. So all the way up to $389.80 per month. That's per individual. If you happen to be fortunate enough to be in the higher income, you're also paying a lot more for your Part B premiums to the government. Now, the difference between the 104.90 and the 121.80. Last year, the premium was 104.90 for this first tier. And there was actually a lot of push in CMS and the Congressional Budget Committee to increase these premiums by 50% in 2016. This was towards the end of the year, in the September-October timeframe. This was the projection. Fortunately, they were able to protect only a mild increase on these Part B premiums, just to be basically a 16% increase on the Part B premiums. So it's still increased across the board. I just lost that. Sorry. but it only went up about 16%. Now, the difference between the 104.90 and the 121.80, for the folks that were paying the 104.90 last year, so they were already on Part B of Medicare, and they were taking their Social Security benefit last year, they would remain at 104.90 this year. And the reason for that is because the Social Security benefit, the cost of living adjustment, was 0% this year. So basically, since they did not get an increase on the cost of living adjustment for their Social Security, they would not get an increase on their Part B premiums. This is called the hold harmless provision, and essentially protects people that are taking Social Security, that are on Medicare, that they're not going to get an increase that's greater than their cost of living adjustment. So for everyone else that's in that first tier, if you're signing up for the first time this year, or even if you were already on Medicare last year in that first tier, but you weren't taking your Social Security benefits, all those individuals are going to pay the $121.80 per month in 2016. All right, the next slide we're going to get to is the Part D premiums, and essentially these are the same income tiers that the Part B premium adjustments apply to. And if you're under 170,000 modified adjusted gross as a couple, you're just paying the plan premium, the cost of the drug card. There's no additional income adjustment for that first tier. But if you're in one of these higher brackets, you're going to be paying, $1,270 additional per month, all the way up to $73 additional per month if you're in this highest income bracket. So all in, if you happen to be in this highest income bracket, it's about $460 per month per person that you're paying for your Part B and Part D to the government, which is quite expensive, $900. And again, that doesn't include a supplement yet or a drug card. It's just for your Part B and your Part D premiums for those folks in the higher income. Okay, so when should you enroll in Medicare? So for most people that are not still working at the age of 65, there's this 7-month initial enrollment period. It's built around your 65th birthday. Essentially, it's 3 months before the month you turn 65. It's the month you turn 65, and then 3 months after you turn 65. This 7-month initial enrollment period is when you have to enroll, unless you fall into an exception, which we'll talk about after this slide. But for most people that aren't working at this age or retired, this is your 7-month period that you need to enroll for your Part B coverage. And it's very important you enroll during this period. If you don't enroll, there's a 10% penalty per year for each year that you're not enrolled when you're supposed to be. So, for example, if you wait 3 years before you enroll in your Part B of Medicare, when you're supposed to have it, you pay a 30% penalty on that Part B premium. And it's not 30% for 1 month, it's not 30% for 1 year, it's 30% for the rest of your life. You pay this penalty on your Part B premiums. So it can be very, very costly if you don't sign up when you're supposed to. This is actually why this is the number one biggest mistake we see from both a volume but also an impact perspective are people that are not signed up for their Part B of Medicare when they're supposed to be signed up. There's an illustration at the bottom of the slide. If someone's birthday was on September 10th, this would mean that their effective date or eligibility date is September 1st for Part B of Medicare, but they can enroll as early as June 1st for Part B of Medicare. The effect, again, if you enroll June 1st, your effective date is still September 1st, but you can get it out of the way. We recommend doing it relatively early in the cycle before your effective date. Additionally, there's some interesting rule. If you happen to be born on the first of the month, you're eligible the prior month for coverage. So if your September 1st was your birthday, you could actually get effective for your Medicare August 1st. No great logic for that. It's probably a congressman's birthday on the first of the month, and they got some legislation passed for the extra month. There's no good reason for that. Okay, so there's a lot of exceptions to that. So the 7-month window is for most people that aren't working anymore at the age of 65. They need to sign up for their Part B. But what if you are still working and you're on a group insurance plan? There's this concept of who pays first. So which insurance coverage is going to pay first, Medicare versus the group plan, for example. And it's going to depend on the size of the group. So the first example here, if you're 65 or older on a group plan or your spouse's group plan, it depends on the size of the company that whether or not Medicare pays first or the group plan. So if it's a small company, less than 20 employees, then Medicare is primary. So if you're still working past 65 and you work for a small company, you have to get your Part B of Medicare because it's going to be the primary payer for any sort of claim that you have. If you don't have Medicare, the group insurance company, Horizon or AmeriHealth, whoever you have the insurance with, doesn't have to pay for the claim because you don't have Medicare. Medicare is your primary insurance. So it's extremely important if you work for a smaller employer or you're 65 and your wife works for a smaller employer and you're on the group plan, that you have to have your Part B as your primary coverage. If you work for a larger company, so 20 or more employees, the group plan is primary. So you don't need to have Part B of Medicare. If you're not paying a lot to be on the group plan and it's decent coverage, you probably just keep the group plan until you decide to retire. However, there's also cases where folks are on the group plan. Maybe they are contributing a lot to that group plan, or they're to cover a dependent who's Medicare eligible, and it may be better off, going to Medicare with a supplement. So, but if you stay on the group plan in that larger company, it will be the primary payer for the insurance. There's same two rules apply to Social Security disability, but it looks at a larger size group, so it's looking at less than 100 employees or more than 100 employees, but it's the same type of concept. Medicare is primary for less than 100 for Social Security disability, and for more than 100 employees, the group health plan is primary. The last two rows here are important as well. For a retirement plan, Medicare is primary. So if you have retiree benefits, you still need to have your Medicare Part B. That's your primary insurance. The retiree benefit will pay secondary after Medicare pays. And same goes for COBRA. A lot of people don't understand this. This is where we see that biggest mistake. A lot of people age 65 or older go on COBRA when they leave an organization, and they don't realize that COBRA is not primary coverage. So again, same situation. They can have a major claim against that COBRA insurance, and the carrier does not have to pay for that claim if you do not have your Medicare Part B. It's very important that you in those situations you have your Medicare Part B. You do have an 8-month window when you go on COBRA to sign up for Part B of Medicare. However, because it's not primary coverage, we recommend doing it right away because it's the COBRA carrier doesn't have to pay for your claim if you don't have Medicare as your primary coverage. And in most cases, COBRA is going to be very expensive compared to a Medicare supplement. It's probably not the right option for folks that are Medicare eligible. All right, so what are your two options when you go on Medicare as far as how you can take your benefits? You can't do both of these. You can only do one or the other. The left side of this diagram is original Medicare. You can go with Part A and Part B of Medicare, and you can add a drug card and a Medicare supplement to cover the 20% that's not covered by Medicare. So this is one option that individuals have when they go on Medicare. The other path individuals can take is called a Medicare Advantage Plan. And this is, if you remember on that first slide, this is Part C of Medicare. It's another way to take your benefits. It's a fully privatized insurance option that an insurance company is managing now your Part A, your Part B, and your drug card in most cases, all bundled together, provided by an insurance company. It's generally an HMO where you need to stay within a network and you have referrals. It's just a different way for you to take your Medicare benefits. This slide just describes the differences between these two paths we just talked about. Medicare Advantage is replacing your Part A and your Part B of Medicare, where original Medicare with a supplement is just supplementing. You still have original Medicare from the government, the Part A and B, the hospital benefit and the doctor's benefits. You're still getting that from the government, and you're just supplementing that to fill the other, that 20%. It's also called a Medigap, to supplement or fill that gap that's not covered by Medicare. With a Medicare Advantage plan, in most cases, you need a private network. So it's an HMO. You need to stay within that network, within that service area, those doctors and hospitals. With original Medicare, you can go to any doctor or hospital in the country that takes Medicare, which is about 90% of doctors, 98% of hospitals accept Medicare. Referrals are required, so if you want to see a specialist with a Medicare Advantage plan, you want to go to the chiropractor or podiatrist, you need to go to your primary physician first to get the referral to see the specialist. With original Medicare, you just call up the chiropractor or the podiatrist, you make an appointment, and you go. With most Medicare Advantage plans, the prescription drug plan is included. With original Medicare and a supplement, you need to get a separate Part D drug card, which, again, we're going to talk about towards the end of this presentation. The monthly premium. So for most Medicare Advantage plans, the premiums are lower than Medicare Supplement. And this is probably the one reason when people do end up going with a Medicare Advantage plan, this is the one driver, is that the monthly premium cost is generally lower than a Medicare Supplement. It's not always the case. We've seen some Advantage plans that are over $100, $200 a month, which doesn't make much sense to us. But that does happen with some of these Medicare Advantage plans. The out-of-pocket costs. So with a Medicare Advantage plan, the maximum out-of-pocket is up to $6,700 per year with a Medicare Advantage plan. With the Medicare Supplement, we're going to get into a couple of different types of supplements today, but it's very minimal out-of-pocket costs. From $0, one plan I'll show is $166 out-of-pocket, and there's one more that's a little bit more than that. But essentially, it's nowhere near the $6,700 out-of-pocket costs you can have with the Medicare Advantage plan. And then the last row in here, guaranteed renewable for life. A Medicare Advantage plan changes every year. So October 15th to December 7th, you basically have to revisit and select a new Medicare Advantage plan every single year if you choose that path. With a Medicare Supplement, it's guaranteed renewable for life. So once you get that coverage, it's federally regulated coverage, and it's you're guaranteed to keep it for the rest of your life, assuming you keep paying the premiums. Okay. All right. I just had a question pop up here, and I'm going to go back to the last slide. I think it was Mary Ann. Let me see here. Let me get back here. The question was, is the information basically specific to New Jersey or nationwide? Medicare is a federal program, so the rules associated with Medicare, there's some supplemental rules, let's say, at the state level, but for the most part, these are federal rules. So, for example, the fact that you can go to any doctor or hospital in the country that takes Medicare, that's a federal rule around original Medicare. The maximum out-of-pocket on a a Medicare Advantage plan up to $6,700. That also is a federal maximum for a Medicare Advantage plan. Guaranteed renewable for life. Again, federal rule. These Medicare supplements are guaranteed renewable for life, and the Medicare Advantage plans change every year. And it's going to depend on the insurance company and which plan they want to offer as far as these Advantage plans and what they cost. But it's, it's across the board that it's, you can guarantee renew on a supplement, and the Advantage plans are going to change every year. So, yeah, for the most part, the information that's being shared is, across the board, across the country. So, all right. So there's three. There's about 8 to 10 different Medicare supplement options out there, but there's three that are really most popular that we see, from our clients. And we just want to walk through these in some level of detail so you can see what coverage is included with each of these three types of supplements. We're going to hit the Plan F, the Plan G, and the Plan N. F is the most coverage you can get, but it's also the highest premium. G is one step below that, so it's a slightly lower premium, but it's one step lower in coverage. We'll talk about a difference there. And then the N is, again, lower premium and lower coverage. So we're going to walk through a few of these examples. Now, one note here is the F plan used to be the most popular for our clients. The last year or so, the G has become the more popular plan. It's just a better value from a premium versus coverage perspective in most cases. So that has become the more popular policy that we've seen, at least last year, and continue to be in 2016 as well. Okay, so how do these supplements work, and how does Medicare work as far as what's covered by Medicare versus the supplement? This table here shows for a Plan F Medicare supplement as it relates to Part A of Medicare. Remember, Part A is the hospital benefit. What is covered by Medicare? What is covered by the plan? And perhaps most importantly, what would you have to pay out of pocket with this plan? So if you get hospitalized on Medicare, and all you have is Medicare, for that first 60 days in the hospital, there's a $1,288 deductible that you'd have to pay if all you have is Medicare. If you're in for longer than 60 days, there's a copay of $322 per day, starting at day 61. If you're in for longer than 90 days, there's a copay of $644 per day, starting at day 91. There's also a lifetime reserve of 60 lifetime reserve days that Medicare will provide if you have hospital stays that are longer than 90 days. With a Medicare supplement, with the Plan F, it's going to pay that deductible of $1,288. It's going to pay the copay of $322 a day. It's going to pay the copay of $644 a day. Additionally, it's going to provide 365 lifetime reserve days after the 60 lifetime reserve days provided by Medicare. So essentially, for the hospitalization, your costs are zero for those hospitalizations. So with the Plan F, that is. If you get transferred to the skilled nursing facility care as part of that hospitalization, and you have to have been admitted to the hospital and then transferred to the skilled nursing care, the first 20 days in the skilled nursing care are covered by Medicare, fully covered. After that, there's a copay. If all you have is Medicare, it's $161 per day. If you have a Plan F, it's going to pay that copay of $161 per day. So you're essentially fully covered in the skilled nursing care all the way up to 100 days with the Plan F supplement. Under Part B of Medicare, so we're still thinking about this with a Plan F. So we looked at Part A, and now this is Part B, which is your outpatient, your doctor's visits, outpatient surgery, testing, x-rays, chemotherapy, kidney dialysis. All of that would fall under Part B of Medicare. There's a deductible of $166 that's not covered by Medicare. After the $166, Medicare pays 80% of the expense. With a Plan F supplement, it'll pay that $166 deductible. It'll also pay the other 20% that's not covered by Medicare. So again, what do you pay? You pay nothing with the Plan F supplement under Part B. There's also something called excess charges, which essentially means doctors can charge up to 15% more than the Medicare approved amounts for the services. This isn't something that doctors can just randomly do. This is an election they have to make over a period of time. They can't just do it to certain people or certain procedures. It's across the board. They're going to charge the extra 15%. And there's two Medicare supplements that will cover that excess charge. The Plan F supplement, and then we're going to hit next the Plan G supplement will pay for these excess charges, so you don't have to worry about that extra 15%. So that's essentially for Plan F. It's full coverage essentially under hospitalization, under Part B. There's really no real out-of-pocket expense once Medicare and then the supplement kick in. There's not really anything left for you to pay in that last column. I'm going to jump ahead now to Plan G, which is exactly the same as a Plan F. I'm not going to go through the entire tables again for a Plan G because they're exactly the same. There's only one difference between the G and the F, and it's the Part B deductible is not covered by the Plan G, but it is covered by the Plan F supplement, as we just saw. So in 2016, that deductible is $166. So you would have to, if you had a Plan G, you would have to pay that $166, and then after that, the plan is going to cover the other 20%, just like the F does. And everything after that, it would be fully covered, similar to an F. So it's the only difference between the F and the G is that Part B deductible. And in a lot of cases, it's a much better value from a premium perspective than a Plan F. You're going to save anywhere from $250 a year. We've seen couples that have saved over $2,000 a year with both of them switching from a Plan F with one carrier to a Plan G with a different carrier. And again, the only difference is that deductible. These are federally regulated coverages, and that's the only difference between the Plan F and the Plan G. One other key point with the Plan F supplement, there was a bill passed in March or April of last year, for the Sustainable Growth Act for Medicare. It had a lot of provisions in it about how doctors get paid on Medicare. And towards the bottom of this bill, there was a provision that basically said that starting January 1st of 2020, there will be no more Medicare supplement plans that cover the Part B deductible. And so essentially what that means is starting in the year 2020, Plan F will no longer be available for new beneficiaries. So new 65-year-olds starting in the year 2020 won't be able to get into that Plan F supplement. If you already have the Plan F supplement, you can keep it. Remember, they're guaranteed renewable for life. But what's going to happen is the age of the population of the individuals on the Plan F is going to start to age at a greater rate than the other plans, because Plan G does not go away in the year 2020. So in the year 2025, the youngest person in a Plan F plan will be 70, which is going to drive up the claims costs as well, which drives up the premiums. So in a short-term perspective, Plan G is generally a better value, but also long-term, there's a chance that Plan F, a very good chance Plan F is going to get very expensive in a few years once they no longer allow new entrants into the Plan F supplement. So the same thing happened about 5 years ago with a Plan J supplement. 2010, they stopped allowing new individuals into the Plan J supplement. And if you look at the pricing today of a Plan J versus a Plan F, which is very similar coverage, it's a good $1,000 to $1,500 more per year for that Plan J compared to the F in certain cases. So just something to think about when you think about Plan F versus G, some of the things that are coming up. One other plan just to talk about with the supplements is a Plan N supplement, which is very similar to a G, but there are some differences. You have to pay that deductible, the $166 for your Part B. After you pay the deductible, then you have copays. So for all of your doctor's visits or specialist visits, you have up to a $20 copay for each of those visits. You also have a $50 copay for the emergency room. And then the other important thing with the N is the excess charges are not covered. So if you remember with the Plan F and the Plan G, they both cover excess charges, so you don't have to worry if the doctor charges that extra 15%. Plan N does not cover excess charges. You would be responsible in those cases that the excess charges were billed. You'd have to pay for those with the Plan N. All right. So when do you sign up for a supplement? Well, you have a 6-month open enrollment period that's built after your Part B effective date. And during this 6-month window, you can get any Medicare supplement you want without any medical underwriting. So this is the time where there's no medical questions asked, where you can get any supplement you want. After this 6-month period, if you want to switch to a different supplement or go from an Advantage plan to a supplement, there's medical underwriting, which is there's about 10 to 12 different questions, depending upon the state and the carrier, that are essentially asking you your health history, and if there's any major medical conditions or recent hospitalizations, upcoming surgeries, physical therapy, then you could be denied access into a different Medicare supplement in the future. But again, during this 6-month window, there's no underwriting. So you can get any supplement you want. It's your guarantee to get the right plan at the right, in that 6-month open enrollment. You get another open enrollment period if you were on Social Security disability prior to 65. Then when you turn 65, you get your second open enrollment period. So just another point there. Now, there's some other situations that are called guaranteed issue for Medicare supplements. This is a little different than open enrollment. Remember, open enrollment, you have that 6-month window where you can get any Medicare supplement you want, and that's 6 months from your Part B effective date. With a guaranteed issue, this is a situation where you already have your Part B. Let's say you've had it for 2 years, you're 68 now and 67, and you've been on a retiree plan. And let's say the retiree plan no longer provides coverage for you. This is something that's happened recently with some large corporations where they started to pull back coverage or change coverage. And you don't want to be, either you don't want to be on the retiree plan anymore, or it's no longer available. This is what's called a guaranteed issue period. So you have your Part B, you're outside of your open enrollment, but you're still guaranteed issue for certain Medicare supplement plans. It's not all plans. The one Plan F, for example, is a guaranteed issue plan, but the Plan G we just talked about, or the Plan N, are not guaranteed issue plans. So in those cases, if you wanted to switch, you'd still need to go through medical underwriting, unless you wanted the Plan F supplement, which you wouldn't have to answer medical questions. So this table just goes through other scenarios that fall under guaranteed issue. The first one, again, was the COBRA retiree situation. The second one is if you're in a Medicare Advantage plan and you're moving outside of the service area, or if the Advantage plan itself leaves the service area, no longer provides that plan in that service area, then that's another opportunity, guaranteed issue for a Medicare supplement, again, for a Plan F without medical questions. The next two are called trial rights. Essentially, if you've been in a Medicare Advantage plan for less than 12 months, then you have an opportunity just to get out and get into a Medicare supplement with guaranteed issue. Or if you went from a Medigap policy to a Medicare Advantage plan for the first time, again, it's within your first year and you want to switch back, they give you the opportunity to do that with the guaranteed issue for an F. The last two is if the Medigap company goes bankrupt, you have an opportunity to get guaranteed issue for another company. Or if the company misled you or gave you misinformation, you have another guaranteed issue opportunity in those cases as well. So that's essentially under Medicare and Medicare Advantage, Medicare Supplements. That's just a kind of an overview for you as far as how those plans work together. The second section we wanted to go through here is the prescription drug plan, and how does that Part D of Medicare work, in that dreaded donut hole and coverage gap, as it's also called. How does that work? So there's really 4 different phases or steps of Part D coverage with Medicare. The first step is the deductible, and this can be up to $360 for the drug card, for that Part D drug card. Not all cards have a deductible. They can be $0, $250, but the maximum they can do on these drug cards is up to $360 deductible. After the deductible is the initial coverage level. Okay, this is based on up to $3,310 based on the retail cost of the drugs. This is not the cost of the drug that you're paying. This is the retail, the full, retail cost of that drug. as long as you're underneath $3,310, you're just going to pay a copay or co-insurance for each of the drugs that you're taking. If you are on expensive drugs and you exceed this $3,310 retail cost, that's when you fall into the donut hole. It's also called the coverage gap. And here's where you really start to spend a lot for your drugs. You're going to pay 45% the cost of a brand name drug and 58% the cost of a generic drug if you're in this donut hole. This essentially doesn't happen to a lot of people, but when it happens to people, it's pretty impactful. They don't really understand what happened. The example I'd like to give is, let's just say you're on a drug and it's $500 retail cost per month for this drug, and you're paying a copay of, let's just say it's $40 a month. And January comes around, you go to the pharmacy, you pick up that $500 drug, and you don't know it's $500. You're paying $40. The pharmacist says $40, you pay, and then February $40, March $40, and you get to July and you go to pick up that drug, same drug, and the pharmacist says that'll be $240. And you do a double take and you don't realize what just happened. But essentially, that's when you've fallen into the donut hole, because you've exceeded. Again, it's based on the retail cost of the drug. If it was a $500 retail cost per month, somewhere around the time of July, you're going to be falling over that. You're going to exceed that initial coverage level, and so you're going to pay 45% of the cost of that brand name drug. And really while you're within that coverage gap, you're going to continue to pay that 45% for brand name drug until if you exceed this $4,850 based on the true out-of-pocket cost. Not my acronym, but this is the acronym. It's true out-of-pocket cost. If you exceed this, there's additional protection called catastrophic coverage, where you pay the greater of 5% or $7.40 for a brand name drug, or $2.95 for a generic drug. So, again, it doesn't happen to a lot of people to get the coverage gap or catastrophic, but when it does happen, it's impactful. It gets very expensive to pay for your drugs in this coverage gap. And if you've made it to catastrophic, the drugs are less expensive, but you've also spent a lot of money to get there. So essentially, that's how the four parts of Part D drug plans work with Medicare. And how do you pick a drug card? So there's 20 to 30 different drug cards, depending upon which state you're in, that are available to you. So let's say there's 8 to 10 different carriers, and they each have 2 to 3 different cards. So the tool we use, it's on Medicare.gov, and it's a website that's available to everybody, and it basically allows us to enter in everyone's individual drug list information, and it does all the analysis for us, and it's looking at the premium for the cards, it's looking at the cost of the drugs in the deductible phase, and the initial coverage, in the donut hole, and the catastrophic, and it factors it all together and basically looks at the total overall expense for the year for each of those drug cards. And then it sorts the list. The one at the top of the list is the least overall expense for the year for the drugs. So that's essentially the tool we use for all of our clients to make sure they've got the right drug card. We revisit that every year, October 15th to December 7th, to make sure that they're still in the right drug card for the following year. And I want to go through just one quick example here for an individual that came into the office about 5 years ago, and he had several conditions, Parkinson's, dementia, depression, and he was taking some very expensive drugs. And he came into the office and he essentially said, look, I want this $40 a month drug card. It's my neighbor has it and he loves it. This is the card I want for me. And we basically told him, well, let's wait a second. Let's take a look at the drugs that you're taking, and let's do the analysis and make sure it's the right card based upon your list of drugs. And so we did the analysis for him. We looked at based upon his list of drugs, entered them into Medicare.gov, and the card that came up the top of the list, which again is the least overall expense, the premium was almost $100 a month. It was $98.30 per month. And the total annual cost was going to be about $4,800 for the year. Again, that's the premium plus the cost of the drugs. All in was going to be about $4,800. And he said, all he saw was the premium. I don't want to pay $100 a month for a drug card. I want the $40 a month card. And so we said, okay, well, we'll take a look at that, and see what that one would cost for, if we went with that it was $39.20 with the premium, but his total annual cost would have been over $12,000 for his drugs, or all in with the drug card and the drugs. And the reason is 3 of his drugs were not covered on the formulary for this drug card. This is why it's extremely critical to analyze based on your specific list of drugs, or the individual specific list of drugs, because it doesn't matter if a neighbor or a spouse or an uncle or brother loves their drug card. It's got to be based on your specific list of drugs. This table here, and you saw it on the prior slide as well, this is actually the level of detail we get from Medicare.gov. And for each of the drugs, it just gives you the list of the retail cost, what are you paying the initial coverage level, what are you paying the coverage gap, and then what are you paying catastrophic for each of the drugs in the list. And for this example, again, the 3 drugs that are not covered on his list, he'd be paying the full retail cost for these 3 drugs for the whole year. There's no protection in the coverage gap, no protection in catastrophic. It would be for the full year, he'd be paying that full retail cost. So this is why that total annual cost is so much higher with this second card. And just for kicks, we sorted the list, and we went to the bottom of the list just to see, well, what would the worst possible card, that he could have selected would have been. And there was a card still $97 a month, so almost the same premium as the one that he should have selected. And the total annual cost would have been over $16,000 for his premium for his card plus all the drugs on that card. And the reason is there was a 4th drug that also was not covered on this this Card C example. So the big takeaway here is a couple of big takeaways. One, you want to do the analysis based upon the specific list of drugs for the individual, and the premium is not the only thing you want to look at. You want to look at the total all-in cost for the drugs under Part D. So just to recap here, I know we're almost at the end of the hour here, but I wanted to just quickly recap those top 5 biggest mistakes that we see folks make on Medicare, and hopefully you can avoid them, or if you're talking to folks that are of Medicare age, you can advise them and to talk to someone, a specialist, to help avoid some of these mistakes. But the first mistake was not enrolling in Part B on time. Again, you've got that initial enrollment period for most folks, that 7-month window where you should be enrolling for Part B, unless you're working past age 65 for a large company. You don't need to enroll during that initial enrollment period. If you don't enroll, you're going to get a 10% penalty per year that you're supposed to be enrolled. Again, that's not a one-time penalty. It's you pay that penalty for the rest of your life on your Part B premium. So it's very important that you sign up when you're supposed to for Part B. With COBRA, remember, Medicare is primary. So if you're on COBRA, you need to have your Part B of Medicare. That's going to pay the primary, the first payer on the insurance claim, and then the secondary would be the COBRA provider that would pay the additional part of the claim. For retiree plan, same thing. You need the Part B of Medicare when you're on a retiree plan. And we also talked about some examples with Social Security disability and the enrollment periods around Part B there. The second biggest mistake we see is people that are not properly analyzing their prescription drug coverage. This could cost thousands of dollars. As we saw with some of those examples that we looked at. There's up to 30 different drug cards depending upon which state you live in, so you really want to take a look. You don't just want to call up one particular insurance company. They will analyze your drugs, and they're going to tell you the best drug card based upon their drug card options that they have available. They're not shopping around to see what the other carriers are that are out there. They're going to tell you the best card based upon their 2 or 3 cards that they offer. So you want to make sure you use Medicare.gov or a broker that can help you out and search for those across all those different cards that are available for Part D. There is an annual enrollment period. You really want to make sure you take advantage of this. Every year, October 15th to December 7th, this is the opportunity to review the drug card and make sure you've got the right drug card for the following year. Okay? The drug cards change every year. Part D of Medicare changes every year. And your drug list could change every year. So even if your drugs don't change, you want to revisit and make sure you've got the right drug card for the following year. But especially if they do change, you want to make sure you rerun the analysis and make sure you've got the right drug card. The third biggest mistake we see people make is not knowing the difference between Medicare Advantage Plan and a Medigap or Medicare Supplement plan. Not understanding that there's a network and referrals that are required with an Advantage plan, or fully understanding the out-of-pocket exposure, for example, with a Medicare Advantage plan. We get a comment. We've got people that call us years into a Medicare Advantage plan, and they're asking to try and get into a supplement, and they've got a health issue, and we ask them, did anyone tell them when they originally signed up about a Medicare supplement? And the response we hear is yes, but we were healthy. So that's really the time that you want to take advantage of the supplement, getting into a supplement. In the future, if you're not able to get through the underwriting, you may not be able to get into a Medicare supplement, which will provide the better coverage. So the point is here, you're not just looking at the premiums. You really want to make sure you look at the whole picture between the Advantage plans and the Medigap Medicare supplements. The fourth biggest mistake we see is people not properly analyzing the retiree coverage. In a lot of cases, companies provide decent retiree plans. If you work for a state system, there's a lot of great benefits out there that you wouldn't need necessarily to go on a Medicare supplement because you've got a good retiree plan. But there's a lot of other cases where a company provides a retiree plan, but you pay a lot for it. You may pay $400 a month, $500 a month. The coverage may not be great. And in those cases, you may be better off going to a Medicare supplement with a prescription plan. So this is really the fourth biggest mistake we see, is people that aren't properly analyzing that retiree benefit against some of the other options that are available. And the fifth biggest mistake we see is people listening to their friends and family. So this happens most often with the drug cards, but it also happens with the supplements or even some of the Advantage plans. My so-and-so has this plan and it works for them and they're happy with it. That's what I want. And you really have to analyze things at a personal, individual level because everyone's situation is different. And this is the fifth biggest mistake we see is people that just do things because their friends and family say to do it, or they're happy with it. So those are the five biggest mistakes that are out there that we see. We have a free guide on our website that provides a little more detail on each of those five biggest mistakes. The website is www.senior-advisors.com. You can also email us at info@senior-advisors.com. Or you can contact us at one of the phone numbers below. If you have any questions in the future, or if you know folks that need some help with their Medicare situation, we'd love to be able to help them out. I'm just going to do a quick check here to see if there's any other questions in the chat that I missed. All right, I think we got most of the questions throughout here. And what I can do after the meeting, I will send out a link to the slideware, so everyone that attended, you'll get a link to the presentation, so you'll have that information. And again, if you have any questions in the future, you can certainly reach out to us, and we'd be happy to assist you. So thank you, everyone, for joining today.